Glen Shor is the Executive Director of the Commonwealth Health Insurance Connector Authority, which is the exchange in Massachusetts, and it's the earliest exchange because Massachusetts, of course, got a start on federal health care reform by enacting its version of health reform several years ago. Prior to becoming the Executive Director of the Health Insurance Connector Authority, Glenn was the Assistant Secretary for Healthcare Policy as well as Deputy General Counsel in the state's Executive Office of Administration and Finance, A&F. And so I'm going to turn it over to Glenn now to talk about health insurance reform from the perspective of Massachusetts.
Thanks so much. I wanted to thank Bob Kaufman and Jeff Cox for having me here today. I really appreciate that. And it's also great to see so many familiar faces, colleagues from state government, from the state legislature, colleagues from staff, and other leaders in the Massachusetts healthcare industry. Really great to be here with you today. Obviously, like we in Massachusetts, and I think you'll hear this from our governor, our legislative leadership, and so many other prominent folks in our healthcare community, we're enormously proud of the accomplishments of the Commonwealth under our historic health reform initiative. This law, which was enacted in 2006, we're now 4.5 years into implementation. And what we can say is the following. Massachusetts has the highest rates of health insurance coverage in the nation by far. Over 98% of the residents of the Commonwealth are insured. That is incredible. We have over 400,000 people newly insured. While we look across the country and we see an unfortunate trend of more employers dropping health insurance coverage, when you look in Massachusetts, you see more employers offering health insurance coverage. We have had consistent, strong, popular support for the Massachusetts Health Reform Initiative, notwithstanding an understandably very contentious debate over national health reform. And, you know, this is not just simply about high-level statistics. This is about what health insurance means to the residents of the Commonwealth. We know of stories of people who have access to their own doctor, a primary care physician, for the first time. People who have been able, with the benefit of health insurance, to detect diseases like cancer early on, get life-saving treatments that would have never been possible or accessible to them if they didn't have the financial and medical security that comes with health insurance. And one great thing about our health insurance reform is that it's not merely about coverage. I think it's really about our economy. I mean, this is an investment in the health of the residents of the Commonwealth. A healthier workforce is a more productive workforce. And I think you all know investments in healthcare and in health insurance have just tremendous synergies with the work that we're doing to innovate, to produce life-saving cures, helping people, and helping the economy of the Commonwealth. So I think this has been a great success. I credit it to, foremost, a really, just a very innovative vision that emanated from the legislature 4 years ago. It's a great privilege to sit up here with Chris Hager, who was just completely instrumental in drafting and in sort of thinking through the legislative foundations for health reform, and there were so many others in this audience who played just a fundamental role in crafting that legislative initiative. It's a testament to a culture of yes in Massachusetts. The governor, the legislative leadership, our entire community just was very committed to making this a success, notwithstanding difficult economic times, notwithstanding difficult fiscal times. Government has poured considerable money into healthcare reform to make sure it works. Stakeholders from the provider community, the business community, the insurer community, the consumer advocacy community have all sat at the table and hashed out some very difficult decisions, everybody giving, everybody trying to find common ground. I think we've produced great results for that. And we at the Connector have been proud to be a part of it. Our mission is to offer more affordable health insurance options to individuals and small businesses. We're very proud that around 215,000 residents of the Commonwealth now get health insurance coverage through Connector programs. That's a very good chunk of the nearly 400,000 newly insured in the Commonwealth. We're very proud to have been, I think, a force for innovation in healthcare. We received a Innovations in Government Award from the John F. Kennedy School of Government a couple of years ago, focused on a variety of things that we're doing at the Health Connector to make the process of purchasing health insurance more transparent and easier, and make it easier for people to see their options, choose affordable choices. For example, we have a website that I think is an unprecedented shopping experiences for individuals and small businesses seeking affordable health insurance, allowing them to make apples-to-apples comparisons of their options and choose the coverage that best suits their needs. We've tried to make very careful, thoughtful decisions about one of the most innovative features of the Commonwealth's health insurance law, which is our mandate that adults have coverage. We've had to define at the Connector who's subject to that and who's exempt because they can't afford health insurance, and also what does it mean to have coverage. And at the Connector, with the support of the legislatures and others, we have said having coverage in the Commonwealth means having prescription drug coverage, because in this day and age, health insurance and healthcare is completely incomplete without having prescription drug coverage. And we have, as we've offered new health insurance opportunities for residents of the Commonwealth, we've worked really hard to make sure, number one, people know about these opportunities. It's not a given once you create a program that people know about it. It takes a lot of hard work on the behalf of the community to make sure that people know that there are options for affordable health insurance. And they also know the value of having health insurance, the access to preventive care, the financial security that it brings. And in the Commonwealth, where if you can afford health insurance, you have to have it. We have to educate people about the consequences of not having coverage. I think the greatest testament to our successful efforts as a community to make this health reform initiative work is the enactment of national health reform. I salute the leadership of the President, Secretary Sebelius, the administration, the Congress, in taking steps to bring affordable coverage to Americans across the country. We're very proud that a lot of the elements of national health reform are modeled on the Massachusetts Health Reform Initiative. And we're very excited about the opportunities that national health reform brings to the Commonwealth. Obviously, there are very important implementation questions that lie ahead. And we very much look forward to working with you to get your input, just as we did in implementing state health reform, to reach the right results. There are great opportunities under national health reform for small businesses and individuals that are taking effect right now. Chris mentioned tax credits for small businesses, opportunities for young people to stay on their parents' policy for a longer time, assistance for seniors in purchasing prescription drug coverage, the elimination of copays for preventive care. That's taking effect right now. In 2014, which is a major implementation date for the law, there are going to be more good things that happen. For us, as a state health insurance exchange, we're looking forward to making it easier, creating new opportunities for small businesses to find affordable coverage, delivering federal subsidies for people all the way up to 400% of the federal poverty level, so people who today still struggle with purchasing health insurance have opportunities for affordable coverage. We're very much looking forward to working with the federal government and stakeholders on rules relating to essential health benefits, obviously a common theme of the state implementation efforts, and the federal law is the insistence that health insurance has to mean something. There are minimum standards for health insurance. Prescription drug coverage is essential. And again, we're very much excited at the Connector to building on the Commonwealth's record of accomplishment in expanding health insurance coverage. I think with national health reform, it will take a lot of work with implementation, but I think the best is yet to come.